EncephaloMyocarditis. The occurrence is worldwide. It's widespread, but it's sporadic and rare. The etiology of the disease, so the EncephaloMyocarditis virus is a part of the cardiovirus genus, which is part of Picornaviridae. There is one serotype, but the virulence has variants. For the epidemiology, it's a uroxin virus, so it infects pigs, elephants, chimpanzees, other mammals, and humans as well. It's zoonotic and birds. The reservoir and the maintaining species or the maintaining host are rodents. They're asymptomatic. It is shed in the feces and the urine, and this is how it gets into the environment. It is a good antigen and it has a higher mortality in younger aged animals. It's subclinical in older animals. For the pathogenesis of the disease, it enters into the body orally, or it can be inhaled, and the primary replication happens in the tonsils. Then a viremia occurs, and the secondary replication happens in the target organs, such as the heart, the central nervous system, and other parenchymal organs, such as the liver, kidney, and spleen, and it affects the fetus. In the heart, it causes myocarditis and necrosis of the heart muscle. In the central nervous system, it causes encephalitis and myelitis, and in the fetus, it causes abortion and stillbirth. For the clinical signs, it can affect pigs at any age, but it's most commonly affecting pigs, like newborn pigs, under the ages of 4 and 5 weeks old. The symptoms are lethargy, fever, anorexia, dyspnoea, and decreased circulation due to the heart conditions, and paralysis, shaking, and ataxia. In growers and fattening pigs, it can cause dyspnoea and sudden death. In pregnant pigs, it causes abortion and stillbirth. In other susceptible animals, it can cause dyspnoea and sudden death. In the pathology, it affects the heart. It becomes enlarged, soft, and pale, and we can see necrotic foci. There's also hydropericardium, hydrothorax, pulmonary edema, and epicardial hemorrhages. In the histopathology, we can see lymphohistiocytic infiltration of the heart and central nervous system. For the diagnosis, we can look at the clinical signs and post-mortem lesions. To detect the virus directly, we can do PCR. But in this case, IF, IHC, and IP are better because there's high amounts of the virus in the tissues, so it's easy to detect. And the virus can be detected indirectly through ELISA and viral neutralization. The treatment, there is none. For prevention, you follow the general epidemiological rules, and there's an inactivated vaccine, but it's not really used. Humans mostly get infected from rodents. It's possible to get infected from pigs, but the majority of the time it's through rodents. They become infected through rodents by inhaling the urine. And to prevent this, you need to have rodent control. There is a public health significance, as the clinical signs, even though they're rare, they can cause fatigue and myocarditis in humans.